let's start now. I will let you hear the voice and we will do comment on it. We are going to speak about maxilla today.
Yes.
Just close the door, please, to hear the voice.
Frontal process of the maxilla. This portion, where it articulates with the zygomatic bone, is called the zygomatic.
Okay, the maxilla is consists with two bone. The upper jaw is united in the midline. All right. This is the right side and this is the left side. It is attached with the frontal bone. It is attached with this part is
Temporal.
called. This is the zygomatic bone.
Yes.
The temporal bone is this posterior part. This is the temporal bone. All right. So let's continue.
Zygomatic process of the maxilla. This
So this is called the maxilla have posterior, upper, and inside, and lower part. We are going to see each part alone and what is the anatomy of this one. So this one is called the zygomatic process of the maxilla. This is the all right. This is the zygomatic process of the maxilla.
portion
Let's
that
go.
articulates with the teeth.
This is the alveolar bone which the teeth is inserted inside.
That's called the alveolar process of the maxilla. And before I flip it over, also note that we have an orbital portion of the maxilla here.
This all the fat of the eye and the muscles of the eye is relaxed on this part of the frontal bone. In blowout fractures, we are going to talk about it. The eye, if somebody received a heat on the eye, like a tennis ball or something like that, this floor is broken and the eyes fall inside with the fat. So we ask the patient to move his eye up. He cannot move. What happened? It's called a trap door. It means it's broken, the fat fall down and the eye is stopped inside. Okay? This is called blowout fracture. You will see in the future. So now we are seeing the maxilla from down. This is the palate. Hard palate, yes.
Except the anterior 2/3 of the hard palate. Posterior process of the maxilla. There's two of them. Okay, let's do sutures.
This is the suture, midline suture.
We see we have a suture here. This is called the intramaxillary suture. Okay, I like to call it the inferior intramaxillary suture because we have an anterior version of this as well.
In cases of fractures, we can see this line is opened.
This brown bone, we covered this a little bit already. This is the palatine bone,
Okay?
which is shaped like an L. See, here's part of the bottom of the L, which is the horizontal plate. Some call it
The
transverse
soft
plate.
palate is inserted
Then
here.
we have the major vertical part of the L here. This is the perpendicular plate of the palatine bone. If you look closely,
This is the
you can
palatine
see
bone,
it
okay?
splits, it bifurcates at the end into a sphenoid process here. And I don't know if you can see that, but that's the orbital process in front. And then we have a foramen, very important foramen right there, which you can see. That's the sphenopalatine foramen.
Sphenopalatine foramen. We have the inferior alveolar nerve, the inferior palatine
That's the horizontal
nerve
plate
which
again,
come
palatine
and come
bone.
from here.
This is, it has a suture here. That's called the interpalatine suture. Now the palatine bones meet the maxilla in this suture right here. And when it comes to naming, the maxilla is always in the back of the bus. It's always last. So this is the palatine maxillary suture. Palatine maxillary suture. Okay, so let's go back to flip this guy back on this side. While we're on our suture roll, let's talk about these sutures. We have a suture here between the zygomatic process of the maxilla.
Knowing the sutures is very important because when you have facial trauma, these sutures are open usually. And sometimes it is associated with the maxillary fracture or zygomatic fracture or frontal fractures. So for any reduction for the fracture, we have to return the fractures line and put in place and fix it with a plate. titanium plates and screw. So you have to know this part is maxilla, this part is zygoma, this part is frontal. You have to know this one, all right?
Yes.
Yeah. To reduce the bond and put
This
in
is called
place.
the zygomatical maxillary suture. Zygomatical maxillary suture. We go into the orbit.
This is the
See
nasal
it
bone.
again, right here.
Okay, this is the floor of the
Still
orbit.
zygomatical
They
maxillary
have a
suture.
foramen also.
Yeah, this is okay.
We covered these already, but the suture between the frontal bone and the frontal process of the maxilla, this is called the frontal maxillary suture. Now we're missing the nasal bone, one nasal bone, but this, see why we might as well say that, it's the frontal nasal suture right there.
This is the frontal bone.
Yes.
But there is a
We
suture
have frontal sinus inside.
between the nasal bone and the maxilla, right here. So that's called the nasomaxillary.
This is important for plastic nasal surgery if somebody have the cartilage or something like this. And usually when we are doing plastic surgery for the nose, we are fracturing this bone and we put in place somebody who have deviation or something like that. We are separating the bone from here, we are separating the bone from here and from the midline sometimes. And if there is some extra bone here, we are, by using chisel, we are putting the nose in a shape, and after we are putting a plate to fix the bone in good position. All right, this is the nasal bone.
Suture, nasomaxillary suture.
This is nasomaxillary suture.
We
All
haven't
right,
done the orbit yet, but
this
we're
is
slowly getting
lacrimal
dedicated
duct.
tape to
When
it.
we cry and things like that.
There's an articulation
Yeah,
here
there is.
between the, what's that bone? Lacrimal bone and the maxilla. That's called the lacrimal
Maxillary suture.
suture. Lacrimal maxillary suture. Okay. Now, remember I said
This foramens is important. We have
Foramen
the infraorbital maxillary branch, which is coming from the second trigeminal nerve, which comes through the pterygomaxillary fossa, go inside the infraorbital groove, and it's come from the infraorbital foramen. It's give innervation to the upper
Canine.
lip, and the nerve which is coming inside the inferior anterior palatal and inferior alveolar nerve give innervation which come inside the bones through the tuberosity, give innervation for the central incisors. The middle upper alveolar nerve give innervation for the premolars, and the posterior upper alveolar nerve give innervation for the first, second, and third molar. That nerve come from the back, we will see, through the tuberosity. Okay?
there was an inferior intermaxillary. Here's the anterior intermaxillary suture right here. Okay, and it goes over these little bumps, these little sharp
That's one, that's
things
why
right
we wash
here.
it. No man like me.
To the side view, you can probably see these better. Okay, those are the anterior nasal spines of the maxilla. The nose hole, which we don't call a nose hole, what do we call this? It's a piriform aperture. It is formed by these nasal notches. So it's the nasal notch of the maxilla here.
This is
We have a foramen here.
nasal notch.
You can see it on the other side as well. That's
Infraorbital foramen. It's very important to give anesthesia, to anesthetize the upper central incisors. All right.
You can see right here and here for the
This is the
infraorbital
groove where the nerve come inside
Is there a
and go.
suture right here? What's
So usually when we have orbital fracture or zygomatic fracture or maxillary fracture, this nerve is damaged, is crushed. So the patient will feel numbness. He will tell you my lip is numbness, like when we are giving anesthesia for the upper, for extraction of upper teeth. This numbness, it will heal sometimes if we put the bone in a good position. But once the nerve is cut, that if after 6 months there is no, the hope became very less. But if it is only injured or smashed, by putting the bone in good position, there we have option, we have possibility of healing. All right. Usually it takes between 1 month to 3 months, but if it's exceed 6 months, the hope become very less. It's a sensory
No,
nerve, all
there's no
right?
suture between the sphenoid and the maxilla here. This is the, what is that structure? Inferior orbital fissure. V2 goes to.
So inferior alveolar feature, which is going the nerve inside and coming from here. Okay, this one is called inferior alveolar feature. It's important.
We'll talk about that more. Get to the orbit. Zygomatic bone, let's hit real quick. It's a small one. Remember I said in the
This is the zygomatic. This is the frontal bone, and this is the condyle, and this is the glenoid fossa. Okay, this is the zygomatic arch.
Yeah.
This is important also in fracture. If somebody receive a hit on this area, this bone is fractured and gone inside. This one will press on the coronoid process, and the patient cannot open his mouth. So we go through the muscle, we open here a small wound, and we go inside and put the bone in place. Or we can go through the oral cavity and go inside and put the bone out. You have two way for reduction. All right.
first video, it's important. It's got an AKA, 2 AKAs. It's called the molar bone and the zygoma, the older terminology. And it literally connects the, what was this part of the cranium called? The two big divisions, the neurocranium with the visceral cranium or the facial skeleton. So it has two processes. It has a temporal process of the zygomatic bone right here, which connects with the zygomatic process of the temporal bone, and this is the, what suture? That's the zygomatical temporal suture. Zygomatical temporal suture. This process here, that's the frontal process of the zygomatic bone.
Zygomatic
Now,
process,
here's a
frontal
common
process.
error in the
Okay.
literature. I think I know where it comes from. I actually did some investigation, but this part of the bone, we don't really call this. Do you think it would be called the maxillary process, the zygomatic bone? But it's really not. Actually, Grays called it that back in 1912.
Before we are saying process. Now they changed. They are not using process
the
words.
14th version of Grays, which is the one I have by Strandring. This is actually called the maxillary margin. The
Okay.
maxillary margin
From process to margin they are using.
of the zygomatic bone. So it's not a process. But it does form again the zygomatical frontal suture here. We talked about this suture, right? Did we talk about that? That's the frontal zygomatic suture. And now there's three surfaces here. We have, the body has three surfaces. There's a lateral surface here. And then we have a orbital surface here. You can see a hole right there, Freeman. I'll put that above.
This is zygomatic nerve will
There's
come
also
out.
another hole right here. That's the zygomatical facial foramen. For the passage of the zygomatical facial nerve.
Okay.
So we're talking about surfaces, and then we have this is called the temporal surface right here. And that forms part of the anterior border of an important fossa called the temporal fossa. Which if you have time, we'll talk about the dreaded fossas later.
Okay, so look, you can see this one. You enter the YouTube and you see this is the human cranial osteology. You can see it, all right? You can, next time you prepare for the muscles and for the
Hi,
nerves
guys.
and
Welcome back.
artery
This
and
is
things
Dr.
like
Gillard.
that. Okay? This is the, let me give you another lecture now.
Sorry, doctor.
Yeah, this one,
Can
YouTube.
suture happens in here?
How many
I see
suture?
it-
See,
I see it in the one case. This bone was broken.
yes.
All.
This is, I will talk about you. Look, this one, sometimes
In
it's
horizontally.
depend.
By
If
accident.
the trauma dashboard like this, if the suture is opened here, then you have to unite and we put a plate, 4-hole plate with a screw, to fix this part. All right.
No,
We
I mean
continue
not
on our
like that.
discussion.
Like that.
That one, okay.
That
This one is called, look, the Lefort one, as I told you. Start from the back and take all this horizontal line. If
Of human
in
skull,
surgery,
osteo-
in orthodontic surgery, we cut from here down. We according with with the association or we have to consult or work with the orthodontist. He do a cephalometric study and he say, please cut me the upper jaw and bring it front about 1 centimeter or down 1 centimeter or back centimeter to put in a good occlusion. It's depend if the patient have class 3. The class 3 is the lower jaw. Class 1 normal, but the teeth are out. The class look, this is class 3. Class 1, class 2, the upper jaw is up and the jaw is down. So sometimes you are doing 2 surgery in the same time. Orthodontic surgery is cutting the bone and bringing, this is called class 1 fracture. We broke the teeth, we moved the jaw, just we put it in 1 centimeter or 2 centimeter. The orthodontist, he is telling how much we have to put in good relation. And the lower jaw, if it is in the back, we bring anteriorly. If it is front, we bring it posteriorly. So we have to put the jaw in good articulation and we fix the teeth. Once we fix the teeth with arch bars, it is Eric arch bar we say, we fix the teeth in good occlusion, then we start fixing the bone that we fractured.